And now I sit on the hospital board as well, and I'm interested to see how your program, how it might be integrated with the things that we do at the hospital. And also working with HealthLink in the doctor's offices.
It worked. Okay.
Sorry, Amy Gorley. I'm a licensed clinical social worker. I have a private practice. I have an office in Valparaiso and in Plymouth.
Hello again.
Hello.
Anita Gooden, Kankakee Valley Broadcasting, WKVI here in Knox.
Okay.
Media.
Perfect.
Thank you. I appreciate it. Thank you guys so much for having us here. So, is it okay if I just kind of start talking about some stuff? Okay. We have a meeting next week, right?
Yes,
Yeah. Okay, perfect. Good. I'm excited about that. So we are on a 92 county tour. You guys are our 4th county today and our 38th county overall. We have been really kind of changed how we're doing things at the Department of Health to be really intentional, to be out here to make sure that we are doing everything we can to support the work at the local level. A large part of the legislation that came out last year and the funding, which we're calling Health First Indiana, was recognizing that the best work is done at the local level, that you guys understand what your needs are here locally. And you also know or have a good idea about what needs to be done to address it. That includes working, with hospitals and, local FQHCs and other members of your community. And so we're here to really learn from you, to find out what you're excited about, to talk to you about what you're worried about and what you're thinking about for the future. We are going to all 92 counties, including those that didn't opt in to the funding, but we're excited that the county commissioners here were one of the what is the commissioner? You're the commissioner, right? Yeah. One of the 86 counties that did opt into the funding. People often ask, why didn't the other 6? It varies a little bit between the 6. Some of them were just kind of in a watch and wait and see. We do expect everybody to opt in next year, pretty darn close to everybody. So excited about it. Do just want to highlight, so for the past 20 plus years, Stark County has been receiving $50,000 from the state to do public health, and your local health department can share clearly that there's a lot to be done in the public health space, right? This year, because your county commissioners opted into the funding, you'll be receiving $263,000. So that's a big increase from that 50,000. And then next year, if they continue to opt in, it'll be almost it will be $500,000, $508,000. So again, a really significant increase to what it was previously.
I will warn you that it says 5 million here, but I'm willing to negotiate on that.
It's an extra zero in there.
So I will tell you, these are new. Literally were printed off at like 6 o'clock this morning. So there's actually other errors I will not point out to you on this page. Yes, we'll take out that extra zero. Sorry. we can negotiate. You can negotiate with the legislators. So it's 508,000. Still, that is a lot from that 50,000 that you guys have had before to address your health issues locally. Also, you will see on your paper, we do have the county health metrics. We are data driven and want to help our local health departments to have good access to data and data analysis as well. So underneath all of these health metrics or even further, you can dive even further, right? I always use infant mortality as an example, which you guys do very well in, ranked 11th in the state. So 1 is good, 92 would be a poor health metric. In some counties that have the higher infant mortality rate, we're actually able to dive in and identify that it's being driven just a couple zip codes, right? So we're working with the local health departments. If you guys, picking one of your health metrics, like, hey, can we have some more information around that? Is you have demographic information, et cetera. Yes.
I have a question about that. Is just that Stark County is the 5th best in adult obesity? I mean, I'd love that to be true, but I find it hard to believe.
That's
Seems not right.
Either we're better than I thought, or the state's worse.
Yeah, so the state's 35th percent, 35%, right? 35% are obese. Our highest obese county is 40% or 41%. So I will tell you, the obesity data is not my favorite. I think it's an important metric. We do know we are one of the most obese states in the nation.
When you start getting into your 100,000 population, that kind of thing. And that's what I found with the county health rankings over the past few years.
Yeah.
So that's it. You've got us down for 4,814 years of life lost. And when county health rankings comes out, we're in the 11,000 and something.
Mhm.
So it's just kind of like, and then I go through and
Yeah,
tabulate, what have you, and,
right,
you know, we're bad,
right,
but it's
right,
not
right.
as horrible as what it's projected.
Yeah, so the obesity data here is based on survey data. But we are actually working because we know that our hospitals collect this information, right? You're collecting height and weight, our clinics are collecting height and weight. So you have the BMI data. So that is what one of our big goals here in 2024 is to actually have that true data so we can get better information for our counties to act
Okay.
on.
It
Yeah.
comes from hospitals.
Yeah,
Data.
seems like.
So this is from survey, so just people answering the phone for Burfus, which is a national survey, but done here in Indiana. So it depends on who answers the phone, answers the question. I mean, they do all the proper calculations and everything, but it'll be better if we have our real data that we know we do have.
Good mental health days and bad mental health.
When you say with the phone calls, very few people here have a landline anymore.
That's right.
You have a business, so
Mhm.
are they calling on cell phone?
Yeah, they are. They are, but most people don't answer their phones these days either, right? I mean, so we,
That's not-
That's the number.
yeah, it's an antiquated way of getting this information, especially when we know we actually have that data, right, in our community. So that is one of the areas that we're working on getting better data. We also talk about that we recognize that 1/3 of our kids in Indiana are overweight or obese, and 2/3 of our adults are, right? So what's the work that we're doing to prevent that 1/3 from growing into that 2/3? And that's really where we want to help support our counties to do work in that area of prevention. Yeah. Yeah, but great. Thank you for pointing that out. I think in smaller communities, these numbers there's opportunity there, and that's where our data team is going to be able to help. Pam, I don't know if you wanted to point out a couple of the other health metrics here.
Sure, so we, Stark County fares, according to the data that we have here pretty well in adult obesity, infant mortality rate. There are some other areas, and these are just 7 of the indicators that we have on our county health scorecard. We are looking to build out more and be able to get more county data out to the counties, because that gives you more of an idea of what's happening in your communities and can be used to make decisions. Some other key points to note would be that, and Frank, you mentioned this, the years of potential life loss due to injury. So Stark County ranks 88th out of 92 counties. And this is really around premature death in looking at folks who have died due mostly to traumatic injury, such as overdose, suicide, might be an accident such as a motor vehicle crash or a farming accident. Another point is life expectancy. Stark County ranks 87th out of 92 counties in life expectancy, with an average of 73.7 years of life expectancy versus the state rate of 76.5. And we know that there are some significant disparities in life expectancy across the state. If you look at, for example, at Hamilton County, which is the Noblesville, Fishers, Carmel area, average life expectancy is 81 years versus Scott County in southeastern Indiana, where the average life expectancy is 72 years, which is a difference of 9 years of life. So some significant disparities across the state geographically, and really rooted in many of the things that contribute to some of these other factors as well. A lot of social determinants of health and some of these other issues, but really being able to look at the data so that you can decide where you might want to start looking at funding and programming and partnerships to start making a difference in your communities. We know we won't move the needle on some of these overnight. It's going to take some time, but what we can do is start looking at what the impact is of the activities that you're doing, numbers of people served, and the impact in your communities. And this is a great starting point to look at where you might want to start looking at activities.
Another point I want to make about the life expectancy is that it has gone down over the last decade here in Indiana, and primarily driven by people between the ages of 25 and 64. So it is our working class community that are dying at a younger age, and that has primarily been driven by substance use and mental health, so suicide. But this is got to know where you're at, right? To know where you're going. And so we're very thankful that the legislators recognize, hey, Indiana ranks poorly in our health metrics across the nation, that it is time to do something. We all see this as an investment and of course the health of our community, but this is also an investment in our economy. A healthy workforce is a better workforce. And it also is not just all of us who are working in the community, but as we're recruiting businesses and employees to come work into our communities, people want to live in a healthy state, a healthy county, a healthy city. And so it's really an investment into improving things. So with that, I was hoping maybe the health department, if you guys wanted to share some of the things that you're thinking about or talking about with how you want to utilize the funding.
Yeah. That's what I gotta get back to work and figure out.
That's right.
I've not worked the past 5 months, but as far as RC safety program, billboard, got billboard up, gun locks. Got that information put out to law enforcement, Narcan. I mean, so as far as injury prevention or anything like that, I feel like we're doing just as much,
Good.
you know, as any other county our size, if not more. We need a full-time food inspector, right? Currently, we're contracting, so we've got that set up. So hopefully when I get back to work, I'm able to go through and start doing some interviews and get somebody hired in that position.
Yeah.
And that one, we'll be able to do preparedness updating as well, until which time something comes about where we need more, but. And then it's a part-time immunization nurse, because with my status now, I'm not going to be going into someone's home, getting TB sputums and anything like that. So I'm gonna be playing more administrative role than the nurse role, but still there is the nurse role.
Yeah.
But like I said, my plans for it, I want to start being able to actually do lead assessment, and that's something that we've been talking about already. Immunization rates, that's gonna be a hard one. I'm sure we're not the only county, but that's it. A lot of religious exemptions out there now that aren't on paper, and just the way it is. And as far as whether the problems with VaxCare that I'm hearing from other counties, that's kind of an issue for me as far as I want to go to VaxCare or something like that. So that we can offer more vaccines to more people, but there's issues with it. And I don't want to step into a pot of something that already got problems. So hopefully some of that can get resolved. But again, I've been off work, so I
Right.
kind of,
Yeah.
I've been helping, what have you, as far as when something comes up, directing where it needs to go, but I'm gonna doing this meeting, that meeting when I can, but otherwise we're fully on track to try and better these numbers.
Yeah. Well, it's good to see you. I'm glad that you're here. I'm sure your community is thankful too that you're able to join us today.
Yeah.
I think we often hear from communities that they've recognized that there's a need for a long time, right? And then now is kind of the first time where they can get things going. But we do believe this is a building year, right? That's why the legislators were intent on doing it's only half of the funding of what we actually have recognized is needed. Half the funding this year so that you have that time to build, and then also, bring in your community partners to help come up with a plan. Okay, what are we going to be doing in
And that's been a
2025?
big thing over the past
Mhm.
16 years that I've been here. It's funding, where funding gets cut, somebody has to go.
Yeah.
And the jobs got dropped down where I had 7 people in this department when I first started, where there's 3 of us. And we contract out one. So.
Yeah.
And that gets done when he's available. So then anything else I have to take care of or,
Mhm.
so. That's it. The funding's gonna help for sure, as far as being able to actually get back up to what we should be doing more consistently.
Well, one of the things we talked about when you presented this at,
Mhm.
well, a couple of meetings that I've attended now, but.
Yeah.
The other thing I think is that, in small counties like ours, there's a lot of partnership. I mean, the other
Yes.
thing is obviously we're not gonna build a 40-person health department.
Mhm.
And then in a few years from now, the state change the funding or delete the funding, so I mean, I think, partnership for us is key. And so that's why we're glad that we have, we have an FUHC here that, that is one option. I don't know if some of it is, the hospital, probably takes a role in some of that too, but
Mhm.
for us, I mean, I think that's what's really important. And I think what would be nice too is that as the program rolls out, if some of the counties are ahead of us, I'm sure your office is gonna be sharing some of the successes or letting us know what other counties are.
I have some shame, copy paste, whatever. works.
Yeah, right. Yeah.
Good.
Yeah, I come from the fire service and so we share everything
That's
there
it.
too.
I
And
mean, I work with the hospital, I work with the schools, I work with the doctor's offices during COVID. Other than the people, it couldn't have ran any smoother. We stayed on top of everything as best we could. I made
Yeah.
sure everybody had the updated information as soon as it came out.
That's it.
And I had an amazing group of volunteers that helped me get through all of it. So if it wasn't for them, then yeah, the whole county would just have COVID and we would have went home, but it worked out good.
Do you guys want to talk about what you guys are doing to help the local health
Sure.
departments learn from each other?
Yeah, absolutely. That's really kind of one of our big goals is just to connect local health departments to each other and to connect the local health department to partners and subject matter experts. We have a monthly regional call that we really highlight a success story from a local health department, share what they're doing. And then they know that any local other health department can reach out to them. We also have a subject matter expert on every regional call that can really talk about the core services, the KPIs and how to meet those. One thing that we're really excited about are quarterly workshops, and that is where subject matter experts from the Indiana Department of Health come to the region and really talk with them and drill down on, okay, let's do some brainstorming. Let's figure out what you need in this community. We've done one already on coalition building, so tobacco and healthy lifestyle coalitions. And then our next one is going to be on maternal and child health. So very excited about that. And that's just going to give the opportunity for the health department to really be one-on-one with that subject matter expert. Also, like Ann was on a call the other day, and she was talking to a county who was really just starting to build up their tobacco coalition. Right? And you were able to share that immediately out with all the other health departments. So if you want to tell them just a little bit about what you learned there, that was really, I thought it was great.
Yeah, so one of the things that I'm trying to do after I've done my initial introductory visits is just do follow-up calls every month or so with our health departments and let them tell me what is going well, what they need assistance with. And so Warren County, which is a very, very small county and limited resources, has been able to develop a tobacco prevention coalition, and it's going to be joint tobacco prevention and healthy living. And their health officer assisted them with gathering partners in the community, and they've held a couple of meetings and are starting to create some goals for what they want to work on together. So even in a small county with limited resources, they were able to pull together the stakeholders that could partner together and work together on something. So it's not just the health department having to do this. This is everyone in the community recognizing a need and working towards it.
And then we plan on having them on one of our monthly calls to really talk to everybody else about how they did it, the steps that they went through.
The state just released our funding for drug and tobacco free, so
Oh, good.
last year, so Porter County is actually running it now, and I've got contact information for that individual when I get back to work as far as
Good,
setting stuff up. I
excellent.
mean, and that's my thing. It's a matter of what can I use the money for? Because with local health maintenance and trust account, kind of hamstringed, I can't use it for this, I can't use it for that. And now, it's like, looking at some of it, it's like, I have people that call and we've got bed bugs, what do we do? We can't do anything. It's like, you gotta call an exterminator, have a SAM cleaned, I haven't got any funding to be able to help you. It looks like what I've seen so far is that's possibly an option, but then it's just gonna be a matter of how do I determine who gets what? Is it first come, first serve? Is it?
Yeah.
Yeah.
Rate based, what have you? I don't know. Stuff I gotta figure out. And that's just one of the things.
And I think that's where you use your local elected officials and your community-based partners to help with that prioritization,
Yeah,
right?
And that's it.
Yeah, and
RC program that I started, it's a matter of, if you are on Medicaid or you qualify for WIC, you qualify for car seat if you're a Stark County resident. You get in a car wreck in Stark County and the car seat isn't usable. I don't care what county you're from, you need a car seat because you don't have one available. We've got one for you.
Yeah.
That kind of thing, but it minimal money to start it and get it going.
Yeah.
So,
Yep.
I mean, we're fine so far.
Great. Yeah.
So-
And you have full flexibility with this funding. I mean, to address the core public health services, something that comes up in some communities is, yes, mental health isn't specifically listed as a core public health service, but it is there, right? So if you all identify a leading cause of trauma and injury in your community as substance use or mental health, then use the funding to address that, right? So it's really how you want to use it. Something else that we talk about too is the nice thing about this funding is it's not specific. It's not, here's a program, do this exact program, for the next 2 years
I
that.
want some of that though.
Yeah, well,
You know what I
yes,
mean?
well, that's what they can help you.
Yeah.
Yeah, and that's where our subject matter experts who are talking to people really across the nation to say, here's some evidence-based programs that we have seen work, right?
That's my thing.
We'll
I
get
don't
that
want
information to you.
That
Yeah,
contractors,
Yep.
as far as doing
Yep.
this,
You want-
doing lead assessment or anything of that nature,
Right.
I want something already set
Yep.
in place,
Yep.
so it's like, hey, I need help.
we'll help you,
Because I don't have
but
enough of it to hire somebody, to
Yeah.
hire somebody, so
Yeah.
I mean, it's that kind of thing.
yeah, you
A
need.
lot of stuff that you need to get back to doing on a regular basis that we were doing when we needed to.
Yeah.
And we need to be more proactive at that,
Right.
and with money, it will help us do that.
Did you have a question?
Yes, with the drug abuse part of it, is it common for them to be, you to be working with the local coordinating councils? I mean, is that common? Is it expected? Is it not expected? That kind of thing.
So this is all driven locally. So it's how you guys want to approach this and how you want to bring people to them. So to go back to substance use, some of our counties are recognizing, okay, well, we also have opioid settlement funding, right? We now have this Health First Indiana funding. Here's our problem. How are we going to best utilize both of these funding areas to address these needs, right? So that there's no duplication of whatever the needs are in the community. It's also working with your FQHCs and your hospitals and your other clinics to say, what are you guys doing? Where are you identifying gaps? So another example, a community recognized they had a high number of, like overdoses and suicides after someone left an acute stay in a hospital for like a psychiatric episode. And at that time, right after they were discharged from the hospital, was really high risk. And so they've hired a community health worker to be with that person, like not 24/7, but to like help them navigate that acute time after discharge to get them established into outpatient. So there's a million different ways that you can do this. And it's up to you guys. I mean, really how it is that you all as a community leaders in your community want to address it.
Thank you.
You're welcome.
We have found from several counties
Mhm.
that will pull together a group just like this
Mhm.
and meet like every month or whatever works for them. But being able to hear those different perspectives and voices and share ideas,
We've done that several
yeah.
times.
that's great.
We've done that several times.
That's good.
It always goes off a different direction though. Stop.
We've had some
Or
different
start.
ways that we did it too. I mean, we did a study through economic development. We also had funding through Owen County, where we did something through the judges chambers, and it was quite interesting. And a lot of it always comes back to the same thing in Stark County. Even then, like, we don't even have like violent offenders here. Almost every problem that we have here comes back to mental health,
Mental health,
and a
yeah.
big part of it is drugs abuse.
Mhm.
And so I'm interested too, like, it's
biggest
obviously
part
great
of
that
it
we'll
was
be able to take care of it, but on top of it, how will the state decide our KPIs? And because obviously we're gonna have to fulfill that to be able to sustain the funding, so.
Yeah.
How will that develop?
Great question. So we've already developed or established our state key performance indicators. Those are going to go live on our website in January, once that funding goes out, right? So people can start to address it. The local health departments have to report on it every 6 months. And then the local health department, you all get to develop your own key performance indicators, or actually the statute requires it by December of 2024. So you have a full year to dig into your data, to have meetings like this and say, we want to do 1, 2, 3, 4, 5. Here's the metrics we're looking at, and this is how we want to drive to success. And we have the support to help you guys get information if you don't have it. Your hospitals, honestly, and your FQHCs, they have a lot of this data too. I think that we need to do a better job of making sure we're getting that information out to the broader community. So the state level key performance indicators this year are about, let's just get started, right? So one is identify leading cause of trauma and injury in your community and implement a program to address it.
Yeah, and like even like things like Marty brought up, like, there's a little bit of sort of a blend here, like for example, with obesity.
Yeah.
Maybe these obesity numbers are accurate, but I guarantee the problem that we're having is people aren't eating healthy. We have this program at HealthLink that's food is medicine.
Yeah.
And I think, things like that too, just to get people eating healthy, because I guarantee people aren't. If this is true, maybe it's not obesity, but our problem is we're not getting proper nutritional value. With most of the food planning that happens here.
And even when people come in from the food banks, the lines are so long, they just wrap around blocks and the food runs out before people have the opportunity, and there's not a lot of food locally that can help conditions. There's a lot of prepackaged box foods that in many cases will worsen a hypertensive patient or a diabetic patient, but that's all they can get. So to your point, that's the intent with that food as medicine program, but that's
Well,
it's a
even with
desert.
that, your guys' program that you guys have in place as far as contacting your patients and that, as far as coming in, we got a box of food for you.
Mm.
And then you have no shows. You know, and so that, and that's. It's the apathy and everything else is what, as far as what our problem's been for decades. As far as people, they'd rather complain that they can't make a buck, get insurance, what have you, but then there's no jobs and our education rate's low, so then the education rate low, so we don't get more jobs coming in. And then you throw pills in the mix, and that's been our big thing here.
I'd like to see some more of our numbers too, like, you know,
Yeah.
cancer numbers, diabetes, you know, other things too. I'm sure we're challenged with, you know, with other metabolic things too.
I got
that-
local numbers for you, as far as going on the desert, because I do that every year.
Dave, that is so, it isn't just related to what, I mean, you got a chicken eggs thing, because it's easy to say you can't get the food at the stores, but if they do offer it, people have to know how to cook. They have to know, I mean, I don't mean to be cynical, but they have to know how to cook. They have to understand what a healthy diet is and kind of, you
And that's
know,
something for two,
you know,
does often.
yeah.
How often you guys do like cooking classes, anything like
Yeah,
that? Yeah.
we have someone that does it,
And it's
but
homemakers, yeah.
she's covering 3 different counties.
Yeah, I know, and that's it, it's like when it's available, and so if there's an ability to do more of that,
Well,
but I just don't know that that's.
But one of the things that I found, to Dave's point, is that even our food bank.
Yeah.
Our food bank here in northern Indiana has very little food. When we used to get, and I help with distributions, I help set them up, that kind of thing in my job. And when we used to get at least once a month food delivered to distribute, now we're getting it once every 3 months. Unless somebody like HealthLink purchases it individually and has one on their own, but that food bank, at least that particular one, I don't know, I don't believe it's across the state, but that one is hurting as far as them getting money. They can't even offer it daily like they used to. So the food is limited because it's more costly and
Well, the economics drive it, because you know what, you're raising a good point, because I'll tell you, when we had a lot of people getting COVID money, we had some food drives here. And I'm telling you, like, I'm embarrassed to admit it, but I had people pass me a couple of things because they're like, hey, this was gonna get thrown out. Because nobody showed up, like there were some of them that like hardly anybody showed up and all this food was there. So I think, you know, the thing that we have to do here is couple education with the nutrition, you know, with hunger, you know what I mean? It's not even so much hunger. I think for us, we need to use the food, like, you know, food is medicine, you know, type approach.
Yeah.
To, you know, to where we can just help people eat healthier too, because, and obviously the economy seems to be taking a little bit of a turn now too, so I think that's a little bit different. I don't think the subsidy is, you know, as relevant now and things like that, so that's probably gonna start ticking up too to where.
there's
people are-
another piece to that though, Dave, as well. When you have all these no-shows. In most cases, it's because they don't have transportation. We don't have public transportation here. There's a real problem with transportation. And once 4 o'clock comes, they can't call community services because they're closed. And so that literally, I mean, that's our only somewhat public transportation.
Yeah, well, actually, there are communities that use Uber and think, I mean, I know we don't have Uber.
We don't have.
There are ways we can grow that too, with, you know, other things besides just having a bus that goes around, but. like
But
I
it's
said,
a
there-
problem that has to be addressed
Sure.
because,
It has to be addressed, but this is not the level of money that we're getting, what we're talking about right now.
no,
You know, and
it's
that's
not.
it. That's the thing, that every time we have these meetings or anything like that, we identify the big problems. We're able to tackle 2 of the small ones,
Sure.
and this is enough money to where we're actually able to.
Yeah.
Address more than just a couple of small ones. We're actually able to address some bigger issues.
But the difference of when everybody says, oh, we had nobody show up and that kind of thing. There's
That's-
reasons behind it. I mean, I understand that nobody showed up.
The transportation is part It's part of any of it, between
I
food
understand. it.
distribution, between drug treatment, between medical treatment. I mean, that's it. Everybody shops out of
There's
county,
also the will to
but yet
participate
they have no
involved too.
transportation.
I work with Toys for Tots with ABATE, and we hand out toys, you know, in the winter, and sometimes we have people call and say, well, we'll take it if you bring it over. You know, but then they finally drive over, pick it up, and they had the means to do it. They just didn't want to go out and do it either. So I mean, part of it is just getting the motivation to,
That's not common though.
We've heard the concerns around access to good nutrition, right? We've, for example, in our most obese county, which is Miami, they acknowledge that half the county is shopping at a convenience store, which is your box and your frozen foods, which we know, how do you keep food, from going bad as you put salt and sugar in it, right? And so they're like high salt, high sugar, high calorie processed foods. And then we heard in DeKalb County also transportation is an issue. And so they've actually started to try and solve for that with ability for transportation for things like getting to food or getting to healthcare clinics. We heard that from Clinton County as well, that their most in need community is on the whole opposite side of town as their local health department and their hospital. And so that they know that that community just cannot get to them. So they're working, honestly, utilizing this funding to say, this is how we're going to improve health in our community. Part of it is access. So I really do think you guys do. You have the ability to sit down and say, here's our priorities. This is what we're going to do. This is how we're going to use it for this year. Right. And then there's also next year.
Some,
Yeah.
They all need to have produce.
but some of them actually do have produce.
Yeah.
Not all of them here.
No, yeah,
Two
yeah.
of them have produce. I
Yeah.
wish all of them had produce. I
Yeah.
wish I would have made that a caveat before I gave them the permit.
the produce is actually pretty good.
Yeah.
Yeah.
And it was less money than the grocery store
Yeah.
for the produce.
Right. Yeah.
Because
Well, so
that's-
Miami
that's-
County.
That's the way we're
Yeah.
addressing food deserts now is with Dollar General.
Yeah.
So
Well, I mean, the other thing is too, is that, you know, things build on each other. And as the government gets more engaged in that, local government gets more engaged.
Mhm.
The county officials, we might be able to put more pressure on the local stores to say, hey. In your advertisement, your POP, you know, you should talk more, you know, this is healthy. You could pair this with this to this, you know, to make a healthy meal.
Mhm.
As an alternative, just, you know, selecting something that's unhealthy. So. I think that, you know, that gives us the opportunity to reach out and do some of that as well. The same with the restaurants, encourage them, you know, maybe to offer some, you know, some meals. I mean, one of the things I do like about traveling, it guilts me more than anything, but traveling internationally for my day job. Every other country has all the calories for everything that you order off the menu listed. So instead of having a milkshake and everything else, it guilts me into getting a salad and a cracker. You know? You know, but those kind of things are helpful because it gives people education, and right now we don't do that, you know, I mean, luckily, we don't fill machines with candy bars and pop anymore at schools, but. You know, that used to be the thing too, you know, so.
I do have a question.
Yeah.
Dave kind of touched on it a little bit, but the funding here is through 2025.
Yeah.
So, are you aware of what might happen after that? I mean, do they intend to continue it? Because nothing is worse than getting all excited and starting a program and trying to initiate things, and then all of a sudden there's no more funding for it.
Yeah. When we're talking to the legislators and when this came forward, out of the legislation, it was not intended to be a 2-year thing.
Okay.
It's just, you know, the state budget is done every 2 years. And that is when that next budget cycle will happen. They recognize and have, that it's going to take time to move the big needle here. We're not going to move from the 35th most obese state in the nation, right, in 1 year, really, because there's only 1 year funding before they do their next legislative session. But we are going to be able to see some difference here, right? So if you go to your local elected officials and say, you know, we have been able to give this many car seats. We have now worked with our local Dollar Trees and they're all offering produce. We've implemented, you know, how to cook a healthy meal in our schools, utilizing our school liaison and funding for other things. We're working on transportation to make sure that our seniors can make their appointments. Go to your legislators and tell them, show them how this funding is benefiting your community. And that's what they need to know. And that's what they need to see. We're going to be doing that to our fullest ability on our end, being very transparent. I talked to you about the website, tracking the activities that are happening here locally. So you guys can refer people to that website, if, you know, here locally, and also your state legislators, and we'll refer people there as well. We'll be talking to them and bragging about the great work I know you all will be doing, but they don't want to hear from me. they want to hear from all of you, right? You elected them, they're there to serve you, and you're gonna have to keep them updated throughout this year on what all you're doing.
And when
Yeah, you do, good for you. Good for you.
On the food classes at the schools or anything like that, you have the kids, you know, if you bring a parent, you get extra credit and that kind of thing. That way it kind of incentivizes the parent to actually come in and maybe they'll pick something up.
Yeah.
Well, we
But-
also do all the food
Yeah.
classes, but no one knows. There's gotta be, when we do this, some method of communication across the county that people can even know.
And that's my thought as far as like with the schools or anything like that, because schools have great communication with their parents and everything like that, as far as sending stuff out on Messenger and what have you. So.
I think as much as you can go to where they are, right? We know the events of where you invite people,
Yeah.
it just doesn't work, right? When we, during COVID, when we went to where the people were in the community to host like the testing events, that's when they were very successful. So it's going to the school, it's bringing crock pots for free, right? Come and learn how to cook a nice healthy meal in a crock pot. We'll come with the food, we'll come with a crock pot, you give it to your families, you get to teach them, right? And then kind of start the process there.
But
I love my crock
here's
pot.
something too, I mean, I work with a lot of the cooking classes that are going on in the school are from the youth club, not the school itself.
No,
But
yeah.
the school itself, they have a third party where they procure all of their foods
Mhm,
and prepares it.
mhm.
So, I mean, well, there's certain things the school prepares and other things that the third party provides. But I've been trying to get into the school as far as, we have a program with local farmers and trying to get the local farmers, food into the schools. And our schools can't, the schools that have the third party can't do that
Yeah,
because they have a
part of their
contract.
contract. Mhm.
And therefore, I mean, so I kind of spin my wheels at some days. And other days I have, I have a colleague that has a solution. And so, but it's real hard to get into the schools once they've talked to you and they kind of turned you off because we can't do that. As soon as they've established in their minds that they can't do it, they're not looking for a solution.
They got higher ups at the Department of Education.
Do you all have a school
Other
liaison
school
yet?
Districts can do it, so.
No.
I
No,
don't
not
know
yet.
why we
When I
can't.
talk to my schools, they don't want one.
Right.
And that's it. I have communication with them. They're able to conduct what they need to conduct. And as far as hearing, vision, screening, anything like that, immunizations, again, it's, you know, religious exemption. So
Yeah.
we've got a large majority of kids that just, they don't want vaccinated. Parents don't want to vaccinate.
Our school's more like hands-off, where we got it handled, and in many cases, they have it handled.
Whenever I've
But
had
it's
that
not
mass
opening up
vaccination clinic,
Ideas for something
School.
different.
We've got two new superintendents and we've got one, and the remaining one that's been around for a little longer and is pretty progressive. I think there's an opportunity for us to extend the olive branch out, sit down and talk.
I've worked
You know, I
really
think
well with
it's like-
through COVID with all of it. So
Generally, they like their fiefdom and they, you know, they have nutritionists, they have all those kind of things,
Mhm.
but. You know, I think for us, what we want to see this is to see this translate into the home.
Right.
So, you know, if they can at least be the vehicle for it, I mean, I think we could probably think of some ways as a county to try to, you know, sustain that more. And them just be more of
That's
a
a good
vehicle, but
message.
not try to step on their
good
toes with their
transport for
programs they
messaging,
have during
as
the
far as
day.
any of it,
Yeah.
any of it.
You know, just staying out of their expertise. I mean, I realize, you know, you know what you want to do there, but I mean, I think really it would be more beneficial. A lot of these kids have problems when they get home and how they eat and.
Oh,
you know,
yeah,
and-
and there's a program that kids can take the backpacks home of all of the.
No,
food
I
that-
understand, but I mean, your point was about the schools, and I think instead of like, you know, like focusing on that, I think, you know, after that, because a lot of parents in Stark County have two jobs or they're
Oh, I
working.
understand.
They're working when their kids come home. And so, you know, the thing probably that happens is they open up the fridge, they grab some pop, they grab some chips or something like that. So I think there's probably a bigger opportunity
Or
for us to impact, you know, those.
Parts.
I mean, I was shocked. I think I told you this afterwards. I mean, I was shocked to know that we had 47 homeless kids in our county.
Yep.
Funding,
Yes.
260,000 for next year. We don't use the whole 260. It doesn't affect the 508 that we get the following year.
Nope.
We don't lose any of the 260 we don't use.
No.
We don't lose any of the 508 that we don't use the following year.
That's right.
So if third year funding magically disappears or whatever we have
So
from participating those 2 years, we still have that to work with just in case. It's not my intention to try and blow $260,000 on whatever I possibly can for 2024.
Yeah.
You know what I mean? So that's it. I just want to make sure everybody's aware of that. It's like, just because we're not implementing every dime,
Right.
we're saving it. That's what I've done the past 16 years I've been here.
Right, once the funding is issued, it's yours. It doesn't revert back. The state doesn't pull it back. And I also want to mention that if you're receiving any grant funds, like federal funds or any grant funds from IDOH, for example, this funding is not part of that. This funding does not change any grant funds.
So
Those
there's
are
immunization
completely
grant or anything like that. It does
Immuniz-
not, it does not interfere with this. Yeah. This is
Immunization
just
grant.
basically taking the place of local health maintenance fund and trust account monies.
That's right. So your immunization grant, your preparedness grant, none of that is touched. This is the local, the funds, it's the same, it's more money, essentially. It's not going to get pulled back and your grants are completely separate.
Yeah, I do want to say one caveat is a lot of work went into figuring out what do the counties need to be able to do this work. And that's where this number came from, right? So we know,
Cheap. but
yeah, no,
it's-
we know you need $500,000 at least to be able to do the work you need to do, right? So it's kind of that balance of making sure you're taking care and doing what you need to do. And then I also hear you, right? I think
Priorities.
everyone's really anxious about 2025. We are too, but there's been no inclination at all that that legislators don't plan on continuing to fund this. I mean, not at all.
The priorities. I want to get
Yeah,
the
yep,
priorities.
Yep.
taken care of.
Yeah, well, I mean, I think even the startup, I mean, we're fortunate, in Stark County, our elected officials have. Had some things that we've worked towards to bring in some revenue, and I think if we can prove that even if. I'm just gonna say personally, if this makes the county healthier
yeah.
and the state does back out on us, we've got other funds that are coming in that if we can use this for startup money. I'm sure we could be convinced to sustain some things too. I mean, that's the most important thing is the people.
Can I ask you just on a whole different end, like, in terms of, one of the things I think it would be nice, what we're seeing here is. The data isn't very good, in my opinion, and I'm all about data.
Same.
I know Dave, I think is too, probably, but what is there a process, is it a formulated process to try to improve the data?
Yes.
Because I think that's gonna be critical to being, because one of the things I heard, of course, I heard, well, we got this one county that's got bad health, we got this other one that's got good health. And I go, gee, that one county has a lot of money and that other county doesn't have much money. And I think what we're talking, you have to balance for socioeconomic, which is nice way to say income. And I think, somebody mentioned low educational attainment, which, having studied the statistics in this county, the most obvious statistic is low educational attainment. And if you can look at, and Dave correctly once again points out that many households have multiple jobs. It isn't for lack of working. It's that they don't earn as much at those jobs because when you don't have the educational attainment, you don't earn as much, right? So it isn't laziness, it's actually low educational attainment, but that also works with these things like maybe not being as knowledgeable about nutrition and not being maybe as knowledgeable about the benefits of, vaccinations. So I guess what I'm asking is, how is this program looking at addressing or providing information that will help to actually, deal with these things mindfully of the fact that you have education and income disparities between these communities?
So the funding, starting just with the funding. So the funding across the state is per capita. But counties who have a life expectancy that's more than 2 years less than the average, which includes you guys, received an additional $5 per capita.
That's nice.
Yeah. And then for the counties that are like the in-between, they received $3 more. Counties that have a lower social vulnerability index, which takes into things like socioeconomic, single family households, et cetera. Maybe even if their life expectancy was the same, they also received an additional $5 in funding. So there was some accounting of that in just the funding of itself. To go back to the data, I 100% agree with you. We need to do better in data. I will tell you, we've come leaps and bounds in just the last 3 years and how we're approaching data. We're actively working with Regan Street and Fairbanks right now to dig into our obesity data, to what data do we have that we can get more information on that there. And then there's going to be more to come. We have a state data advisory committee now, and we're bringing together hospital leadership and other people in the health data space to help us look into this and say, where do we know that we have this information and how do we become transparent and get it out to our communities? infant mortality has typically been released on a yearly basis, way after the year has ended. We're looking to get that out actually on a quarterly basis, because how can you make changes if you don't see what the results are? That's why part of this funding is having fetal infant mortality review committees, suicide overdose committees here locally. So you guys are looking at what's going on in your community actively. Like if you have, several overdoses or something in a row, you guys are actively reviewing it, recognize that, and maybe can implement a program to address it. So there's lots of different ways that this is all coming together. And what we
Yeah,
piece
I wonder if there's some way to personalize the survey effort more, like not phone calls, like literally. Either we use some of the funding to do it,
We're not-
they does it exactly. Somebody comes with a questionnaire, sits down with the family if they'll accept them.
Yeah.
In all parts of the county and sits down.
And that's it, that's a
You
good
know,
summer gig as
how
far as
do you
anything like
eat,
that.
what's
What's
your-
high school kids sort of
You know,
going
Do it.
around.
What's your health status and things like
Yeah.
that, like those
Put a
kind of
survey
things, we
together.
could use the funding for that.
Yes, yeah. Go to your
That would
local
be great. I mean, we need
churches,
to
go
know where
to.
we'll start, because I'm with Marty. I'm, even if I'm part-time temporary, people are employed to do that, to get started.
Remember, your hospital has to do a community assessment, right? So they should be looking at the
Yep.
data to be able to identify where there's needs, and the FQHCs can do the same thing, right? They are also do an assessment, so they have a lot of that data. Now, that probably doesn't cover all your population. That's utilizing those facilities, but it could get you more than we
The
have right
FQHC
now.
could double that up on a marketing effort for them. And then
Mhm.
double up on our, we could help fund that by doubling up, maybe partnering and getting the
Do
data. for
whatever
us
you
from
want to
that,
do.
you know?
I'm here to cheer you
Double up
on.
data. I can't double up and get more people in without more providers in this area or more.
That's our
Yeah.
biggest problem right now. I mean, we're flush with nurse practitioners, but our doctors' population has just evaporated over the past 10 years.
And that would be my other question.
We went from 2,500 to 3,000 patients per doctor to we're at 5,500 patients per doctor.
That was one of the things when we met that the state was gonna talk about.
Yeah.
Is some of this funding, can it be used to, put attraction packages together for physicians to come to a community? Did you guys discuss that yet?
If it is addressing the core public health services, then you can utilize the funding in any way. Really, the only restrictions is that at least 60% of it has to go to more of the health metrics, and no more than 10% can go to capital. But if you say we have nobody providing prenatal care in our community and we want to utilize some of this funding to be able to do that, what county we're in today that plans on doing that? Marshall County is planning on doing that.
That would be great if we could do something like that too, even if.
That's it, how far is it gonna go? You know what I mean? That's it's a big enough chunk of money to where we can actually make some change, but it's. We're not gonna bring a doctor in,
And then I think
we're
like.
not gonna bring a gynecologist in. We're not gonna bring everything back to the hospital.
Right.
Well, that's where the hospital, I think.
And I
has
know,
this,
and that's it, there's a lot of that.
We're talking about PCP here. We don't have PCP.
I got it.
Yeah,
So,
that-
like,
yeah, we
that's-
don't,
There are.
I know, that's it.
There are things you can offer to attract people.
Family practice can do prenatal care, right? Or a
Sure.
nurse
Yeah.
practitioner or
Yeah,
whatever.
they
that's what
don't
I-
anymore in this community.
Give
They
us a
have-
go ahead.
Very hard.
they don't
You
like
know,
to.
Mhm.
one person working in a rural center with no backups, I can't name a single OB that can take that job on.
Oh,
Yeah.
Aside from OB, yes, malpractice too, like all those other things.
Right.
It makes OB so hard, but yeah.
Yeah.
Um,
But I think that we need to, we're in a position where we need to start being creative with our ideas. So I think all the stuff that you just shared are, they're possible,
And
right?
that's stuff that's been going on.
It's just getting pen to paper.
yeah.
And I think one thing that Dr. Reader, one thing you've made a lot is that. Excuse me, with the funding being as flexible as it is, if something isn't working, you can pivot, you can try something new.
Yep.
As long as it's related to core public health service delivery, that's it.
Yep.
And it's really depending on what's best for the needs of your community.
How do we use this funding? Somebody needs a chest X-ray, but they don't have health insurance because they've been diagnosed with TB. I can use some of this funding to help them get that chest X-ray done, so I can diagnose and get them treated. It's simple stuff that I wasn't able to do with local health maintenance that I am able to do with this that I'm seeing.
I can't wait to see in another month. I mean, having the regional meetings monthly. Can't wait to see what other counties are starting to do also. I mean, I'm excited for the opportunity for us, but also maybe it'll stimulate some things too with some of the other ones that are a step ahead of us to hear what they're doing already.
Let me get back. Okay.
Not working. I know. I'm not saying, I'm looking forward to hearing
Yeah.
the information.
What was that?
How are you organizing, it's the subject everybody's talking a little bit about, multi-county, cooperation. I mean, one of the things, when I worked for the county, one of the things I constantly saw was, Indiana is kind of got a horse and buggy, county system. I mean, the counties are small, and Stark County even more than most. They are small because, they had to be within a buggy ride of the courthouse, and that's literally the reason. And so the counties are kind of small for doing some of these things. And yet it's a challenge to get multi-county cooperation going. Like what you're talking about, Marshall County, Stark County and Marshall County.
I work with Marshall County all the time.
Yeah, absolutely.
I work with Glasgow County all the time.
Yeah.
All the counties.
No, I think
Yeah,
it's
that's it.
really
I work with them all the time.
really helps too.
Yeah. As far as they need something from me, I need
Yeah.
something from them. I mean, that's it.
Yeah, I think the key is really just kind of breaking down those silos, and that's hopefully we can provide that space for them to come together and meet and talk and share ideas. And we've already got counties who are looking, for example, to share a lead risk assessor. So there's one lead risk assessor in this county, and the donut counties are all going to share that. So they're gonna help fund that person. So I think really. And I love the conversation you guys are having right now. I would love to see you guys continue this and come up with your priorities. What do we really want to focus on? And once you have that, contact us and we can get you with the subject matter experts that then can help drive what direction you want to go. And that's really the whole goal of all of this, is just to open up the communication and to let you guys choose what you think is best.
But then being able to provide any technical assistance or resources, support that you need, whether that's just connecting with another county, connecting with one of our subject matter experts at the Indiana Department of Health, or connecting with someone that we know is a community partner that we know is doing that work. So really creating that support for all of you, so you're not out doing it by yourselves, but it's really about the local decision making in your community and what you think is best.
Anybody walk away thinking that the community isn't, lacking. There's a lot of partnerships that.
Yeah.
Oh, yeah.
already been made,
Right.
the schools, Porter Stark services, what have you, but hopefully. As far as they have programs that go on and that kind of thing, where, things are being addressed, and there's no point in me trying to stick my foot in it, just so Stark County Health Departments.
Right.
But at the same, I know the program's in place, so, okay, good, we're covered there.
Yep, exactly.
You
get it.
That's it, I'm not trying to reinvent anything here.
Well, I think that's a good point. That's why it's gonna be important to include everybody,
Yeah.
that's a stakeholder, on that side of it. But I like your door knocking idea. I really like that. And I hope the state might even think, because one thing is, usually when the state rolls something out, we always have to connect it to a consultant. This is kind of nice that you're letting us do our own, or make our own effort here, but maybe there's some kind of a survey company that does door knocking, that the state might want to think about getting a discount across the state. That way it's, all the metrics are connected then, but that would be nice, because I'm sure we're not the only community that needs to go door to door.
And that's my only thing, is a lot of times when you start seeking out someone to do this kind of thing, they do it on a Marion County basis. They do it on an Indianapolis basis, and then when you try and break it down
Absolutely.
to a Stark County or Knox, it's. We don't have that. We don't need that. Where'd that come from? That kind of thing.
I think
We're
we should
smaller.
play a role in our survey.
Yeah.
For sure.
Mhm.
But I think that might be helpful, even if we pay for it out of our funds, but if there's one or two firms that do that kind of thing. Because I don't think we have anybody locally that does that.
I think that's gonna be like the best assessment we're gonna get of something on the most honest assessment. Anybody that has.
How can the media come to the table?
I'll let you know.
We have a great
That's a good
relationship
question.
with the health department.
Yeah.
We have a great relationship with the hospital,
Mhm.
county government.
Yep.
Other government, Purdue Extension.
I always
How
try
do-
to include you just
she
because I get the
does.
word out.
We have a fantastic relationship with the health department. What more can media bring to the table to help educate the community?
I love that.
Yes.
Yes, I mean, you're the voice, right? You take the things that happen to this community,
Yeah.
yeah, right? And bring it out to the community. I mean, I think that's a really great thought.
How are
Yeah.
we being part of these regional conversations?
Mhm.
Sure.
How are we able to collaborate even more?
Yeah.
With HealthLink and other parts that we probably don't know exist.
Yeah.
That can help the community understand what's available to them.
So I think that, and just maybe to think about a couple of ideas. I mean, being part of the local group, that's deciding and kind of making these decisions. Also, we have, when you have community related events that relate to core public health service delivery. Frank, I heard you mention car seats. I heard you mention some other things. Invite your local media, your local elected officials, your state lawmakers to showcase that success. We have our regional communications specialist on our team at the Indiana Department of Health, who that is her job, is to serve local health departments and be able to connect them and provide them ways that they can connect with their local media. We're posting social media toolkits, all kinds of different things, tools and resources. And then Sheila, were you gonna say something?
I was gonna say exactly what
okay.
you just said.
Well, I think we could,
Yeah.
this communications person, we
Yeah.
should probably
Yes.
connect
We can
with
connect
the
you.
media, like in the north and the central and the
Yeah.
south. To like talk about this, cause I mean, she may have ideas that we could never dream up, right?
Mhm.
About ways that they could
And
help
social
improve
media is
it.
hard,
Yeah.
Yeah,
in the fact that I don't have time to sit on Facebook all day.
sure.
And besides, my Facebook's personal and I like to look at jokes and memes and all the goofy stuff. I don't necessarily want to have to work
Right.
on social media. I like to be directly communicated to
That's
about
always
certain
my
aspects
Health
of things.
department has never had a
Email.
Facebook page.
Email, phone calls,
I'm
those
not
types
doing
of
that.
immediate conversation
Yeah.
to be, so we can get to where we need to be to inform the public.
Mhm.
Sometimes I miss things that are 4 days ago. I'm like, well, crap. You know, what do I do now? And then why weren't you there? Well, I didn't know about it.
Mhm.
You know, and my department's very small, so I might not be able to get to every meeting. But at least, you know, maybe I can connect with somebody to get a synopsis of what's going on and communicate to the public. That's my job.
Yep.
I would like to be involved.
We'll work on that. That's a really good idea. Thank you.
I know that we are,
What-
but there's
Whatever they
more.
decide they're gonna do, I'm involved in it, yeah,
On our website, we can we can put
I know.
stuff on there,
I know.
specifically a community health thing on our website. And we can tell people, hey, there's a car seat program going on at the hospital. Hey, they got immunization clinic coming up that's specialized at the school. Hey, we've got something going on wherever, whatever.
I
We
know.
can, they're doing stuff at the community services of Stark County that's health related. We can put that on our website and inform the people. And we can put it on the air.
People drove to it.
I'm not the only media in this county, but I'm speaking for
Yeah.
myself personally.
You're the one that everybody looks to.
We need
You're the man.
to do better.
I'm saying, I know that during the legislative session, some of the rural legislators in the southern part of the state do like a weekly, like on-air interview to update what's going on at the state house.
So we do work with
And
those people.
yeah, but you could try to implement that same model with this team, like what are they working on once a month, like what's new, what are they looking at next month, what programs are they starting off, what resources are available? Just so they get more familiar hearing from them directly.
And we do have great partnership, Purdue Extension. Debbie comes in, she does a program. Sometimes scheduling is a little difficult, but you know, we do hear from community partners, but I think we can do better.
Excellent.
I sat through your presentation in Marshall County, feel the same way with our WIMR Max 98.3 FM. We have this, we're the same company, so we can do the same thing there that we're doing here. I think it's important.
Awesome. Thank you. Appreciate it. All right, we are at time.
One other real.
Okay,
quick.
yeah.
Another thing that we asked about in the meeting, and I don't remember
Okay.
if you brought this up, but one of the things we asked, could any of those funds be used for, we have a county EMS here
Yeah.
instead of private EMS. Can any of those funds be used for EMS activities?
So again, has to address the core public health services. So we do know some counties are gonna be using it to supplement community paramedic work. So checking on moms after delivery, mom and baby, going into seniors' homes to make sure they have non-slip rugs. Do you need railings in to help prevent falls? Some mental health work, some like post-hospital things. So things in that area. Yeah. Does that make sense?
Yep.
Okay.
I thought they had something like that already. When Travis was the EMS director, didn't he, Charlie?
During
Have-
COVID,
Oh, just during COVID.
during COVID, we had special rules, what have you, as far as
Okay.
being able to go into the homes and that, it was all covered under that board, whereas.
In the beginning, it was kind of iffy whether that was gonna be applicable, but it sounds like other counties are already like it's gonna happen, so.
Yeah.
I think we have an
But not
opportunity
for
with that, too.
standard operations.
Not for 911 services
Right, right.
or, or inter-hospital transfer and things
You're
like
talking
that.
about additional services that they could.
If we get some way.
To specifically address the
Program,
corporate services.
If there's any point to vaccinate people at home.
It's a great outreach vehicle for us, since it's a county, since the county.
Yeah, yeah.
It's just a matter, then you're getting into the insurance end of it, and that's, what are we doing,
Yeah, I mean,
Another question, just
I
to
don't,
make sure.
I get confused about what county I'm talking to about it today, but we did talk about too, like, once you're in the home, you can recognize that there's other needs that that person may need, right? Whether it be access to food or electricity or whatever it may be. So there's lots of benefit.
I was just
to
thinking about that
using
whole
your
door knocking
paramedics.
thing. We've
Yeah.
got frequent flyers. I mean, we've got all different kinds of things that we see within EMS. I've was involved in EMS here for a long time. I'll still indirectly a lot of times too, but I think there's ways we can work together too with EMS with this program too.
Awesome. Can we get a group picture before we leave?
Great idea.
Now that it's time for the meeting to start.
I'll leave YouTube on for a little longer. That way no one feels shortchanged. What should we use as the background?
Whatever you prefer.
We used to be able to get another team. We don't think.
We don't
It's
have.
hard.
We can hurry and get it outside.
Yeah,
Get some
practice.
people back here. I'm gonna do outside. Or if so, like, walk.
All right. Oh, wow. Yeah, we can just do it like that. Let me see if we can get it.
Oh, we are.
I mean, even, there was a while there.
Oh.
There was a Mexican lady in town that was running it.
Are you excited?
Oh, she was, Darlene, she was running it and she
Okay.
called, so we didn't even go to, we go all over the place, take it up and then bring it back there.
Oh,
And we go to North Junction and every place.
A lot of good pieces. It was better control on it. I think it went pretty good.
Oh, okay.
Yes, thrown out. All right, I'm starting the train. We're coming over here and take a picture together. You all too. Everybody.
Oh, okay.
Come on. We have to document this happen.
Get up, girl.
The other issue, like. Yes.
We're gonna pick her later. Thanks for being here. Yeah, nice meeting you.
Right.
But we were carrying this paper here.
Yeah.
It was fun. Yeah.
Yeah,
I'm back here.
Sneaking behind you. There you go.
All right, you'll be all right.
To the front.
All right, I don't, are you okay? Are you all
right? Okay, everybody squeeze in.
Charlie.
Yeah. Sorry.
Have a luck, Charlie.
It's this pool. We need to shift that way just a little bit. Okay, perfect. Thank you. Ready, look, 1, 2, 3.
wow, Frank, I can't see you, just joking.
Awesome.
Thank
Thank you. guys.
Thank you.
It's like I got a flag or something.
Thanks
Thank
for coming.
Yeah.
Actually, been a long time. You're not going to sign. This is something I want our leaders. State of Lincoln. This will be a program that
Maybe it's not like-
Like, I'm monthly on summer. So I have been. Everyone's very sort of.
That's fine. Counter.
No, we're.
And it's hard. That's what I'm saying.
Nice to meet you. Love it there. No, I.
Appreciate you guys.
That's not just that you're just visiting. No.
Next time we'll take you guys out for tacos. Somebody warm up the talk?
Yeah.
Okay.
But they don't know.
You can dig it out, whatever. You can dig it out. If you don't know.
They were wanting to know from Porter County. Yeah. Yes, St. Joe, I just wanted to know. As far as how they were. Yeah. Yeah.
So if you just provide me
Yeah.
it's approximately
Page 20, 25, a year. You know what I mean?
So like.
Maybe. You know what I mean?
And because I need the work to provide them like a fee. But.
You know what I mean? That's there to provide Porter County. Whatever they're doing, those outdoors.
The health department.
Well,
Well, I'll take.
okay. You know, I think it doesn't matter what it is, what's being offered during this. You know what I mean?
I know.
I can't afford that. Yes, you can. It's just so hard.
Yeah, I would say 25 a year.
To get.
If I think back to my walks here or your. Letters I've mailed out. As far as letting them know we have. Testing kits available to help. Because otherwise they like to keep us for having free as well.
My family.
Wow.
Take it out of the
You know what I mean? So, 25.
That's for $100.
Even with.
Right.
Mark always tells us he does house.
Well. And they get that information back to them, and then you guys can have that conversation about if it will work or not, but, okay, thank you. Yeah.
No,
A lot of our attorneys use it.
He makes a mean
And they beg, and some people, are very happy with it.
Which is good.
I feel like, as far as private vaccine, if you're not wanting to bill it yourself, which is a really heavy lift.
Leave it upside down.